Let's do it. Okay, everyone. Welcome back to another health talk in our virtual health talk series where we highlight a different health topic every month. My name is Maddie, and today I'm sitting down with Katherine and Elizabeth. They're physical therapists at the Rehab Center, and today we're talking about Parkinson's, which, as I've told you both already, that this is a topic that's dear to my heart. I have family members that have Parkinson's, so this is just it's an important talk that we all need to be having, and bringing awareness not only to Parkinson's but also for caregivers and family members that are watching their loved ones after being diagnosed with Parkinson's.
Mm-hmm.
So I will let you guys introduce yourselves. You're up on the screen here. They can see little boxes of your pictures right now, and then they can see the screen. So I can go ahead and start clicking through the screen after you introduce yourself, and we'll get started. We'll talk for about 20 to 30 minutes, and then the last little bit, the last 15 to 20 minutes, we'll answer questions from the audience. And for those in the audience, your cameras are permanently turned off and your audio is permanently turned off. We cannot see you, but if you have a question or a comment, please put that in the chat. I will monitor the chat, and at the end, we'll go through the different questions that were submitted in the chat. And I've got some questions that I've prepared that I want to ask you guys at the end. So we're ready to go. You're welcome to start introducing yourselves and we'll get going.
I'm Katherine Graham, and I'm a physical therapist at the Rehab Center. And I have worked the majority of my career in neuro rehab and in general medical rehab. And Parkinson's is very interesting to me. I have seen the evolution of the treatment and of Parkinson's and realize how essential this is. So I'm excited to speak today. Do you want to introduce yourself?
Yes.
Okay.
I'm Elizabeth Ardoin. I'm also a physical therapist at the Rehab Hospital. I've worked for about 30 years in different settings, from inpatient rehab to home health, always with a neuro population in mind, and do really enjoy working with the group of people that have Parkinson's. Super important physical therapy, and that's one of the reasons that I really like working with it, because we can make such a difference for people, and that's exciting to me. Sometimes, we can't make as much of a difference, and that's harder to handle as a therapist. And so this group is very exciting to work with.
Well, we're so excited to have you both here. Okay.
Okay.
Through.
All right. So I'll start, and I just want to say that I hope that you have a little scratch pad and a pen, because we might say some things that we just give you a bit of information and you want to make a note for yourself to look it up later. I will strongly encourage you to do that. This month is Parkinson's Awareness Month, and the Parkinson's Foundation has a great month filled with information and some extremely helpful videos. So I'm going to say right off the bat that you should visit, if you do nothing else, visit the Parkinson's Foundation and look and see what they have put together just for this one month. So we're going to start out talking about just Parkinson's, the diagnosis of Parkinson's. And it is as you can see, it's a disease that's neurodegenerative, and it affects the nerves in the brain, in the midbrain, that produce dopamine. And it was looked at years ago. I looked up Wikipedia to see who actually identified this, and they're giving credit to a Parkinson's, to James Parkinson's, who actually was a pharmacist. And this was in 1817 that he published a paper on it. So that's how far back we go. Okay, so when you have this degenerative conditions develop in your body or that of someone it really has started out very slowly, and a person might have had it for years and years before it's ever really identified. And so there's several phases. That's a preclinical phase where you have the disease developing, but nobody can tell. You can't tell. Then later, some more of the nerves get affected in the midbrain, and then it becomes prodromal, meaning that you start to notice it, your family starts to notice it, that maybe you have some movement symptoms, or you have depression all of a sudden, or constipation all of a sudden, and then you go to the doctor, and then you're in the clinical phase, and they can identify the condition. About 1 million people in the United States have it right now, and it's expected to really increase over time. So the first step to living well with this condition is to get educated and to understand the disease itself. And the disease is caused, we feel like it's caused by genetic factors and also environmental factors. And there's some lifestyle changes also that sort of encourage the development of it, but it's mainly genetics and environmental. And I don't really have the opportunity to go into it, but I can tell you that it is helpful to understand this, and there's very good information on the website.
Yeah.
Okay, there is a condition called Parkinsonism, and that is used to describe movement symptoms and non-motor symptoms that don't really yet fit into the condition of idiopathic Parkinson's, but it may. Some people eventually develop the disease of Parkinson's, and so their condition is no longer Parkinsonism, but it's now Parkinson's disease. A typical Parkinsonism is a group of some conditions that have Parkinson's symptoms in them, but they also have, because of protein buildup in the brain, they have different additional complications. And there's several. I'm going to just read off a couple in case you Lewy body dementia, multisystem atrophy, supranuclear palsy, and corticobasal degeneration. So those you might want to be aware of. And so I'm going to turn it over to Emily.
And I actually have a question. You had
Okay.
mentioned that you feel like the number is expected to rise of people being diagnosed with Parkinson's. Do you
Right.
think that's just because we are more educated about Parkinson's and it's being identified earlier, or it's actually being diagnosed, whereas maybe people didn't know before?
We're going to speak to some of the diagnostic ideas or avenues right now that we have. So that's true, and also there is considerable evidence of neurotoxicity in our environment and causing Parkinson's to develop if you're genetically predisposed. So,
Interesting.
so
Okay.
does that answer?
Yeah, it does.
Yeah.
Sorry, Elizabeth, didn't mean to interrupt your slide.
No, you're good. So we're going to go into a little bit more specific with the signs and symptoms now. You can see them all listed there. I will not read them. You can see this looks a little bit overwhelming, but most people with Parkinson's, it like Katherine mentioned, it progresses differently for each person. So most people with Parkinson's may not get many of these ever, or very late in their stages with Parkinson's. So just be aware of that. You can see they're listed as motor and non-motor. Motor is just those symptoms that have to do with movement that we can see, and therefore sometimes they're the most identifiable. The non-motor symptoms, of course, we cannot see, but they actually can be present years before we would clinically see the motor. So they are actually really important to recognize and be aware of, so that maybe we can get people to the doctor earlier and have a better earlier diagnosis, which can be really helpful. The green symptoms there are the 10 early indicators, or the earliest symptoms that we see in most people. Tremor that could be in one foot, one hand, or in both. Shuffling, stiff, or slow walking. People may feel that manifest as I just can't keep up with people anymore when I'm walking.
Yeah.
A stooped posture with maybe forward head or rounded shoulders where you've not had that in the past. a small handwriting or not being able to read your own handwriting suddenly, a low or soft voice, masked face, which you just don't have as much expression in your face. It's also known as a stone-like face, and it actually has to do with the rigidity of the facial muscles. Loss of smell, low blood pressure, which can lead to dizziness and or fainting episodes, constipation, and insomnia, or having sort of like thrashing of your arms and legs, which could be waking you up or your partner up.
Interesting.
And I think I'm good to hand it over to Katherine.
Okay. All right. So, if you think you have any of those symptoms, what would you do about it? And so you really want to get out in front of these symptoms. That is the absolute key to being successful with Parkinson's. And what I mean by that, you need to be proactive. You need to make a beeline to your doctor and have them discuss with you what you're experiencing, talk to your family, make you see if they're noticing something that you're not particularly noticing, but you want to put together these early signs and get a plan with your doctor. You are, if you're, there's lots of studies that show that if you take control of your health, of your Parkinson's situation at the earliest point possible, the outcomes are much, much better. So you don't want to be behind the 8 ball. This is my pep talk slide. You really want to get a hold of it. If you have Parkinson's, you are somebody, you're your own person, you're never going to change. You just happen to have Parkinson's. Don't think of it as being untreatable. You just have to be proactive. Don't wait until the problems develop to the point where you're playing catch up, if at all possible. So that's my pep talk. You can do it. Go to the doctor.
I love that pep talk. Now, I'm sure we have a lot of caregivers on here or family members that, I don't know, may suspect that their loved one has Parkinson's. If you are a caregiver and you suspect your loved one has Parkinson's or they've shown some of these symptoms, how do you bring up that conversation with your loved one? Because I can imagine that's a hard conversation to have. Do you have any advice?
Well, and Elizabeth, you jump in. Of course, it depends on the person's personality and their life experiences. But if you can do it in sort of like a sort of discussional way, if you think they're open to it, you can just say, I have noticed this. Have you noticed that? Same issue, and take it from there. That's obviously one way to go. And then the other way is to sort of observe until the person has a difficulty, like a handwriting issue, and then something that's really apparent, that's concrete, is indisputable, and then say, hey, why don't you go, you're going to the doctor next month. Take this with you. Let your doctor see what this is. And, but you don't need to get into a large debate about it, because a person needs to be ready to come to the table. They'll do much better when they come to the table on their own, if you know what I'm saying.
Yeah, I think one of the hard things with Parkinson's also for people is that many people with Parkinson's have a reduced self-awareness. And so the caregiver might be noticing a lot more than the person that is suspected to have Parkinson's at that point is actually noticing about their own voice or their walking. And you as a caregiver or family member, friend, if you're seeing those things and you're concerned, you can, again, like Katherine said, you can kind of wait till they're more ready, or you can try to at a time when the symptoms are not there, just like you're having a normal conversation at the dinner table, try to be forthcoming and say, all these three things are concerning me, or
Mhm.
whatever those symptoms are. And that
Mhm.
can sometimes help to push in the right direction, but
Mhm.
trying to be honest, but also you need to be concerned because, like we were just saying, we
Mhm.
really want to get to these people to the doctor early. It
Early.
matters. So,
Right. Well, thank you.
and now we'll transition exactly into getting when you're at the doctor. I would say before you even go, please try to bring a caregiver, loved one, family member, friend with you. So you want to be prepared before you go, which means hopefully you could bring somebody with you. Have a list of your symptoms, have a list of your questions before you get there. When you're there, your doctor will probably examine you to see if they're seeing some of those common symptoms. Do you have a tremor? Do you have a masked face? Are you rigid and stiff sort of in your neck and your trunk? What does your walking look like? What does your balance and your posture look like? So they're going to do that examination just like they normally would. Um, Depending on how long the symptoms have been there, or if the symptoms are not jumping out at the doctor, it is often common to take a kind of watch and wait approach for several months to see if those symptoms are progressing or see what happens. Your doctor also could order further testing or blood work to basically rule out other things, actually. They don't want to jump the gun and put you in a Parkinson's category when really we might be missing something. So they're going to do as much testing as they possibly can. You might get a referral to a neurologist. You might get a referral to physical therapy to come and see, hopefully, us. Um, we'd like to see you
Mhm.
simply because we can evaluate and treat whatever movement issues you might be having at that time, even if they're not Parkinson's. And if we're, seeing different things than maybe you're seeing, we will obviously be in contact with your doctor back and forth to let them know what's working in physical therapy, what's not working, and that can sometimes help to steer that conversation as well early on. Um,
Can I jump in right there?
yeah,
I
yeah.
was just going to say the last little bit that you said was sort of what I was going to say. That this is where the family can just encourage, or the yes, the family can encourage a referral to a physician for just, you need more strength, maybe things are getting harder for you, and let the therapist put together some evaluation to help the doctor make that early diagnosis. And hopefully it won't be Parkinson's. It will be something that's even, still treatable, but it's in a different category, but
Yeah.
we can help the doctor get that information.
Mhm.
Yeah, I agree with that. And I
Mhm,
think that's very realistic.
mhm,
That
mhm,
happens in our world all the time.
mhm.
So that's a great point. Your doctor may also prescribe medication actually as a diagnostic tool. So they might prescribe Cinnamate, which is the most, it's a combination of carbidopa, levodopa. That is the most common, widely used medication. But I will say that I think Catherine told me earlier today, there's 52 medications now.
Wow.
There are a lot of medications. But early on, that is one of the prime ones that we see prescribed early on. And if you
Mhm.
respond well to that, meaning most or all of your symptoms either decrease or stop, then that often enough, as well as the evaluation that the doctor did, is often enough for a true diagnosis of Parkinson's.
Mm.
In the last 20 years, however, we have made a lot of progress in the field. And one of the things to be aware of is that there are now tests available. They're more readily available, I'd say, actually, in the last 5, maybe 10 years. But there is a test that's known as a DAT scan and also a skin test. It's like a skin biopsy. And I won't go into those further here
Yeah.
because we don't have a ton of time, but
Yeah.
there's more information on those on any of the websites that we'll mention.
Okay. Awesome.
Catherine, you good?
Oh, no, that's yours, isn't it?
No, that's yours, but that's okay.
Okay, well, let me get busy here.
No, it's okay.
Okay, I was
I
looking at the other one as being,
you keep the other one. I'll do this
okay,
one. It's
okay.
probably fine. I'll
Oh, well.
so this slide is just
Mhm,
some research
mhm,
that came out pretty recently. Actually, I don't know the exact date, but it's basically telling us that early exercisers do better early when you have Parkinson's. If we can early on get you on the correct exercises. So a lot of times we have people come in and they say to us, I have Parkinson's. I was just diagnosed, in the last 6 months or year, and my doctor and everything I read says exercise is a key, but I don't know what that means. I don't know what to
Mhm.
do. Um, and so that exercise, we do want it to be really specific to people with Parkinson's.
Yeah.
But in general, when we get people to exercise early on, their function, that's what this PDQ 39, that is a self-reported functional scale. It shows that people that were exercising at baseline year 1 and year 2, their score was 0 starting out at year 1, and then they progressed to only a 1.8 on that scale. People who were not exercising ever at baseline 1 year or 2 year, they went from a 3.4 all the way up to a 6.2. And we want that number to stay as close to 0. That's
Yeah.
your best quality of life and function.
Hmm.
And so this slide is all about just we need to get you exercise. And if you've truly been diagnosed with any of the Parkinson's or
mhm,
Parkinsonisms,
mhm,
and why that early exercise, it really does matter in the
mhm.
quality of your life and the quality of your function. So,
Awesome.
Okay. Okay, so the next slide is, of course, exercise is medicine, and what this is really telling us is the if you the left hand side, it says dopamine. That's right. The left hand side, that is the amount of medication that you're taking, going from none to high, and then on the bottom, going from left to right, is a timeline. Okay, and so what it's looking at is people on in the red line are the people that are exercising after they've been diagnosed and they are getting the correct exercise. So it's multidisciplinary intensive rehab. It doesn't mean that it's every day, all these, continually through their life with a physical therapist, but it's an exercise program that has been developed by someone who is trained like a therapist to select the appropriate Parkinson's related program for them. Okay, and so it says this is, of course, 2 years, and they've had 2 bouts of exercise. And so the amount of medication needed for those people in the red that have been exercising remains very low. But the people who don't have specific exercises, maybe they just walk. Walking is really good, but they just stroll, their usual lifetime stroll. They over time will need more medication earlier. So that's what this is saying. You want to really think about specific medically guided exercises on and off over time. I heard at a national conference, that they are likening it to going to the dentist, where you go to a dentist for a full out exam, and then you go every 6 months or something to make sure nothing has developed, and that this is the model for therapy services for Parkinson's. And I happen to agree. I think that works really well. And I think that's about it on that slide.
Okay.
yeah, I'll say one more thing on this slide. we often tell people that are coming for Parkinson's treatment that they should take their exercise every day like a medication.
Yeah.
People tend not to miss their medications at all. And we really think for this group of people that exercise really on a daily basis, the right amount and the right types matters. So
Yeah.
it also matters that you're getting the right medication going hand in hand with that exercise. So
Right.
that's really important with that last slide.
Okay, so we're talking now about what kind of exercises. From a physical therapist standpoint, you can get into specific, very evidence-based exercise programs that we know that are very effective with Parkinson's, or you can blend the different types of exercises together, or you can create a more traditional form of exercise plan for the patient, for the person. So we wanted to talk about the specific programs that will give you the biggest bang for your effort. Okay, so the first one is LSVT Big, and it's a high energy intensive exercise program. Just a little background, it was actually developed by a speech pathologist in 1987. The LSVT stands for Lois Silverman Voice Training. Now, this was started by a speech therapist who was seeing an elderly woman with advanced Parkinson's who was in a wheelchair and could barely be understood vocally. And so the Miss Silverman, was really impaired, but she had a lot of money, and this speech pathologist was funded to do research by Miss Silverman, and it worked. And for what they did, which is LSVT Loud, that's a speech therapy program just for Parkinson's. So they turned around and established a protocol for for physical therapy, and that's called Big. So onward, what you do in this program is a one-on-one recognized physical therapy service. The physical therapist is with you every treatment session. You don't even have a PT who's like, that certified in orthopedics or something. It's the only people that are going to work with you are those that have the training for LSVT Big. The sessions last 1 hour, 4 days a week for 4 weeks. It's what I call boot camp for Parkinson's. You absolutely get a significant amount of education, support, individualized problem solving, and improvement of all domains of your abilities, like aerobics, strengthening, flexibility, balance. You get it all in this program. And I think we have a slide, and I can just
Our video.
start big, step big, in big, step big. So this I can talk over, right?
Yeah, I think so.
Okay,
People
all right.
should hear you.
So
Yeah.
this is one of the exercises. And so the therapist is always doing it with you. Okay. And they are individualized for your needs. This looks simple, but trust me, it is hard, even for the family members who come in and learn it so that they can help at home. So it is a very interesting program. It does require a physician referral, and it starts with an evaluation by your physical therapist so that they can customize this program for you. And then there's like a schedule for 4 weeks established. In the event something happens, whether personal circumstance, we can change it from 4 weeks, but it really, to get your best outcome, you need to dedicate a month to this program. It is well worth it, and it is covered by insurance in most situations.
Okay.
Okay. Yeah, I'll let you go. I was going to say something else, but I'll catch it later if we have time.
Okay. I know I did want to give you a time check. It is 12:30. I
Yeah.
would never want to
Yeah.
rush you. I'm giving you that time check.
Go ahead.
Okay, well, we'll try to move along. So
Uh-huh.
we're going to move on to one of the other offerings that we have here in our clinic, which is called Power Moves. This one has its specific skills training exercises that were developed for people with Parkinson's. It was developed, I would say, about 10 to 15 years ago. The research was just, the first research was put out about only 10 years ago. The skills training focuses on 4 different skills: anti-gravity extension, weight shifting, truck rotation, and general transitions that we make. And these are really they use these as the building blocks to get to our everyday function that we use all the time. The 4 moves that they have can actually be in this program done in 5 different positions, such as sitting, standing, lying face up, lying face down, and on all 4s. And so there's just a lot of flexibility in those basic exercises plus those 5 positions to really tailor this to each person's symptoms that they're having and their goals might be in coming to therapy. It really focuses kind of on 4 main symptoms that people with Parkinson's have. That would be the rigidity or stiffness, the bradykinesia, which is that slowness of movement, coordination, and reduced self-awareness that we mentioned a while ago. It again is performed one-on-one with a certified physical therapist or occupational therapist. The intensity of it, because it's very flexible, it can just be decided by us when you come in for a visit between your wants and needs and how much you can tolerate and your therapist. That can be changed a lot. And same with the last one, you do need a doctor's prescription for it. It can just be for physical therapy, but for Parkinson's. And then it is covered by most insurances at the same rate as regular physical therapy would be, any physical therapy.
Mm-hmm.
So, and I think there's a little video of this one as well.
Open. Close.
We, again, on this program, we exercise with the person, and we're hoping by doing that the exercises are a little bit easier to learn. Again, it might look easy. We encourage caregivers to come in and learn these exercises as well, just like we do with the Big often.
Awesome.
Okay, and rock steady boxing. And I think this has been in the press a lot, so I'm not going to talk about it in detail. But we do have the program. We've actually had boxing in some form since about 2018. So we feel very comfortable in offering a boxing program for people with Parkinson's. It is they have a great website, by the way, and if you Google Rock Steady Boxing, it will pop up, and you want to go to their main homepage, and they do a great job of showing you videos and answering some of your basic questions. So it is intended to continue your fitness quest, to slow that functional progression that we feel like therapy and exercise can make happen, in spite of the fact of the progressiveness of the Parkinson's. Okay, and it's performed in here at the Wellness Center in a dedicated room for boxing. We have a variety of punching bags and other boxing equipment, as well as fitness machines and exercise space. The boxing coach is certified. Our head coach, I'm a head coach, and then we have a personal trainer that's a head coach, and we really adhere to the principles and the guidelines for Parkinson's and rock steady boxing. It is absolutely safe. That is our number one priority. There is no physical contact between the participants in this program. everybody in that program has Parkinson's or Parkinsonism. You'll see here in just a second that in the video that you do spar with the boxing coach, and which is a great addition to this type of exercise. It is, before we go to that screen, I just want to say that it improves balance, coordination, strength, mental agility, your vocalization, and increasing different motor skills that you have by doing boxing drills, footwork exercises, strength, and aerobics, all aimed towards those symptoms. And it is a cash basis program. It is not paid for by any insurance that we're aware of. Our fee is very, very competitive and reasonable. We actually will meet with you to start with at no charge to screen and see what your situation is and if you would qualify or benefit from this program. If that is the case, then we notify your physician and we do get clearance so that nobody is coming to this program that's not been medically cleared to box. So let's have that video, see what it looks like.
I love this video.
Yeah. So you can see our gym in the back. That's just a corner of our gym. It's really, we have lots of equipment in our gym. So it's a little fun way to get intense exercise.
Yeah. Oh, yeah.
So.
Here's some additional resources for both people that may think or suspect they have Parkinson's, people that have Parkinson's, and caregivers. There's lots of online information, but we kind of like these two websites the best. The Parkinson's Disease Foundation has lots of exercise links, support groups. They have a newly diagnosed forum where you can ask your own questions, post questions, and get answers. They have booklets on every aspect of Parkinson's, every symptom that we listed before, so that they will send to you for free. So they are a great resource. Michael J. Fox has much of the same. They are a little bit more research based. They have a little bit more of the research on their website, but they're both great resources. And then locally, we have a wonderful support group. You can see that that's at the Watauga County Library the last Tuesday of the month. It's headed by John Paget. It's been in existence for, I don't know, over 10 years, a long time, but it's very well run. They have everything from speakers on the mountain, off the mountain. They sometimes just have a lunch and social. It's for caregivers and people with Parkinson's. So it's a great resource. Then we have over at the ASU Health Communications or Leon Levine building, they offer Speak Out, which is specific to people with Parkinson's. It's another program like Power or LSVT Big, but that one is called Speak Out. They also offer swallowing evaluations if somebody needed that, and individual speech therapy sessions. They also have some other caregiver support groups, a walking group. Those are not specific to Parkinson's, but they are great resources. And then they also offer that Speak Out education group, which restarts every semester. It is also free and it's a great group. They do some education, some cognitive exercises, and some speech exercises. I have one more thing that's not listed on here, and that is every May, the Parkinson's Disease Foundation since 2011 has hosted around the country I think it's called Move for Parkinson's. It's a walk for Parkinson's, basically. I forget the exact name right now. It's on May 3rd coming up. Our closest one is in Kernsville. We don't have one here in town, but that's exciting just because it's around the corner. So, and lastly, I'll say that you have heard a lot of information, a lot of different topics, a little bit of information about a lot of different topics. And you may still not be sure of how to proceed from here. We don't want you to feel stuck or unsure what to do. Please contact Katherine or I. We would be happy to help you. We are here to help you. Have a phone conversation. You don't even have to come in for physical therapy. Just, give us a call or contact us by email, whatever you prefer. And we will try to help you navigate forward to find a really good path for you. We're here for you.
Well, thank you, ladies, so much. If anyone on the call has any questions that they would like to ask or any comments, I ask that you please put that in the chat. And then we've got 5 minutes, ladies. So I'll go ahead and get us started with some questions as people type questions in the chat, or if they don't have questions, that's fine too. So you answered one of my questions earlier where I asked about if you were noticing signs or symptoms in your loved one, how would you address that? So you answered that question. What advice would you give to family members or caregivers about balancing support for their loved one while also taking care of themselves?
So that is a really hard topic, I will say. And Katherine, you jump in.
Okay. Well,
I will
just
say that.
briefly, I mean, I can tell you the first thing, there is help, there is guidance. The Parkinson's Foundation has a beautiful support system in there of information. There's information just on their website. They have online books that you can actually, just subscribe on there at the site and read information for caregivers. There's different chat groups there. I know I'm going through the computer system. I can hardly believe I'm saying all that, but there are a lot of good resources. That you're not alone. That's the thing to remember. It's a journey. When the person has Parkinson's, you in effect have Parkinson's, and many people can support you. That support group that we've mentioned, and there's also one at Levine run by a speech pathologist. That's where you need to go. And perhaps maybe, networking with your friends. Sometimes just a close friend may know a lot more about it than you realize. They may have a relative that has it. So there's very commonly support all around you if you'll just look for it.
And I will also say that, like Katherine said at some point earlier in the conversation, Parkinson's is so different for each person. So just because your loved one has Parkinson's, they are still going to be able to, they are still themselves, and they are still going to be able to do, so many things. And so look to them to still be, doing all the normal things that they have always done. That is what we all should want and expect for that person. So the books for sure can help that are online, which you can order for free, and then those support groups.
Yeah.
And I just have to say, I mean, this is something, I don't know if I should be saying it to patients, but I say it. Anyway, I go, I get the shock and the adjustment of finding out this diagnosis. You can be sad, you can be depressed, but then get sort of not angry, but sort of like indignant. I'm going to do something about it. Take charge. It is a condition in which you can have a full life for many, many years. And if you may never see a lot of change, that's what's sort of, unknowing about Parkinson's, is how it's going to affect you. But you should start and maintain an attitude that you're going to live your life. And this is going to be an annoyance, but that's something that you can deal with. And it does help quite a bit.
Yeah. Well, thank you. That's great advice. I think we should all be living our life that way. Go out and live it. Well, we're at 12:44, so we're we're short on time, but thank you both so much for being here. You didn't have any questions come through in the chat. But if anyone does have questions and they want to reach out to Katherine or Elizabeth, I'm going to share my screen one more time as people exit out. Let's see, you all should be able to see this. This is their phone number there for the rehab center. You can scan this QR code and it will take you to the rehab center's website if you want to learn more information about these different programs that Katherine and Elizabeth discussed. But Katherine, Elizabeth, thank you so much for being here, and thank you for those that joined, and I hope to see you all at the next Health Talk in May. We'll be
Thanks
talking
for
about skin
having us.
cancer and sun safety in May.
Thanks, Maddie. This was,
Thank you.
I'm
good.
gonna leave
Yeah.
this slide up for a little while, so people can scan that QR code, and I'll hop off here in a few minutes. But thank you, Katherine, Elizabeth. Thank you so much.
Thank
No
you.
problem.
Uh-huh.
Yeah. Bye.
Bye-bye.
Bye-bye.